Can you talk about high circulating B12 versus low uptake after 7 days from intramuscular, intermuscular shot? Is this related to mitochondrial nutritional issues? Can biologic drugs play a part? Brian, if you have low circulating B12 in the serum, but you've had intramuscular injections, it might be intramuscular injections are not the best route for you to take your vitamin B12. Try an oral lozenge. A lozenge like I have a formulation called methylcobalamin. It absorbs through your cheeks. And in most instances, I've only ever seen one person do better on intramuscular injection than on oral, sublingual B12. But that would be my next avenue. Would be if you're not pulling your B12 up as a result of those injections, it might be too that the injections are cyanocobalamin, and cyanocobalamin is not all that bioactive and not all that helpful. Can be problematic for conversion. So that's what I would look into. May wants to know, can damage from B6 toxicity be reversed? Yes, it can. And that's the great thing about pretty much most of these things. In most of these instances, the damage is really reversible. Now, where you run into trouble, nerves are slower to heal, and so it can take a little bit of time. But it depends on how long you've been taking that B6. If you've been taking that B6 only a few months, the damage should go away really quickly, after you cease the B6 intake. I mean, we're talking about a few days. We're not talking about a few years or a few months. With vitamin B6. But if you've been taking it chronically for 10 plus years and you've created a lot of nerve damage, it's going to take a little bit longer. So a lot of that just depends on how long you've been, whatever it is, whether it was B6 toxicity or something else, whether, how long that was going on. What can be causing severe foot cramps that radiate in the head, mainly when lying down? Can this be a neuropathy too? It sounds more like an electrolyte disturbance, which can be a neuropathy. So calcium and magnesium, depending on when the foot cramps are happening. If they're happening at night, then there's a strong likelihood you have a calcium deficiency. If they're happening in the morning or during the day, there's a strong possibility that your potassium or your magnesium might be low. But those are the two things I would look at first in terms of the main minerals. Now, dehydration can also do that. And some people that overconsume caffeine. So if you're doing 5-hour energy, you're doing a lot of coffee, 2, 3, 4 cups a day, even tea. If you're a heavy tea drinker and having several cups a day, you can get too much caffeine, and that can cause that type of foot cramping as well. Let's see here. Burning tongue. Yes, Colette, I love that question. So burning tongue neuropathy, number of different reasons, but probably one of the most common is heavy metal toxicity. Mercury toxicity is very common with burning tongue syndrome. Additionally, though, I've seen cases where mold toxicity was the progenesis of a burning tongue. So persons stuck in an environment where they were being exposed to high levels of toxic mold or mycotoxins as creating that burning tongue scenario. Now, those are probably two of the more common for burning tongue. Now, B12 deficiency can cause a burning tongue. B2 and B3 deficiency can cause a burning tongue as well. So I'd look for all of those things to rule it out. Let's see here. Yeah, so somebody's chiming in. Ruth says, didn't get my notice for the show tonight. Look, we're being suppressed. Our information's being suppressed. The powers that be don't want you to have this information. So if you really want to make sure you're getting this information consistently, the best way that I can tell you to make sure that you get a notification is to go to our YouTube channel. That's youtube.com/glutenology. And once you're there, so if you just youtube.com/glutenology, hit the subscribe button. And once you hit that subscribe button, there's a little bell that you'll see. Hit that bell. That bell means that you want YouTube to email you notifications when we go live. And so that's the best way to ensure that you're not getting the email, because we send emails out every time before the show. And if you're not getting it in time, it's probably because your inbox is being suppressed, or my email is not ending up in your inbox. It's ending up in your spam or your promotions box. Okay, can you get neuropathy from being on benzoklonopin for 25 years? I'm not saying you can't, but to my knowledge, I can't answer that intelligently, because I don't think so. I mean, the benzos, can they cause neuropathy? Not to my knowledge. It doesn't mean it can't happen. That's an awful long time to be on it. I'd say it depends on the dose. And I really would say if you've been on it that long, most people that are on the benzodiazepines like that, it's for sleep. And generally they have a hell of a problem in their B vitamins And that's one of the reasons why they're struggling with the sleep issues. So that would be, it may not be the drug that's causing it. It may be the unresolved problem that you were prescribed the medication to take for in the first place. Let's see. I had a disc bulge so tiny, not more than a few centimeters, and pain in my arm. It was work-related, but through tons of chiro, was able to fix it. During the injury, it hurt, and I would take naproxen. So yeah, so that's common. That's good, DeAndre. I'm glad you mentioned that, because some of you with the disc bulge, like, what's the best care for that? Like, chiropractic is great treatment for that. Decompression or spinal decompression or spinal traction is a good therapy for that. Some people find that lasers, cold lasers, are very helpful as well. And of course, physical therapy, exercises, McKenzie exercises, cervical strengthening exercises, all important in overcoming those physical neuropathies where there's a disc herniation or something physical. Let's see here. Tuning in from Michigan, going to learn from my husband, who wakes with foot pain 4 to 5 times every night and has to stand up to relieve it. That sounds like a foot pain of a cramp, Cindy. So I would really, get your husband and his doctor to check his electrolyte levels, and not serum electrolyte either. Again, check that intracellular nutritional status. Let's see here. Yeah, I see that a lot. Like, pain management docs, Toby, will say, yeah, you shouldn't have the numbness and tingling when you explain it to them. Like, a lot of times the pain management, I erased it, but the pain management docs, a lot of times, and it's not your fault, but a lot of people shop for pain medicine. So like, we used to have people come into our clinic all the time wanting to get morphine-based drugs, wanting to get things like oxycodone. They were doctor shopping, and they were addicted to the medication. And that's the problem with opiates, is that you may have the best intentions when you first start taking them, because they're so addictive, though, and you get addicted to them, you'll do things that you wouldn't do because you're not in your own mind. You're not in control of your own mind. But a lot of doctors are really skeptic about pain patients because of that. So they're actually special orthopedic tests that we run on people to ensure that they're not lying to us. They're like trick tests. So at any rate, yeah, it's not an uncommon thing for a doctor to be skeptic about whether or not you're having your symptoms. Is there, let's see, Dora says, I have high B12 but numbness and tingling. Is there a connection here? Doctors here do not seem concerned that my B12 is high. If it's serum B12, there's no toxicity level known with high levels of serum B12. Even if it's over a couple of thousand, it's probably not got a connection with your numbness and tingling. There's something that's being missed, Dora. And I go back and start with this. Start with having those things looked at. Let's see here. Wow, can plantar fasciitis lead to neuropathy in the long run? RH522 wants to know, can plantar fasciitis lead to neuropathy? It possibly could, but it's not really something that we would say, oh, the plantar fasciitis caused the neuropathy. Plantar fasciitis is an inflammatory process that goes on in the soft tissue underneath the foot and in the Achilles tendon, and generally it's plantar fasciitis is usually, in my experience, grain induced. So if you've got chronic plantar fasciitis and you're not on a grain-free diet, that's where I recommend that you start. Go read No Grain, No Pain, because that I've seen that resolve people's plantar fasciitis time and time again. Just the diet change. It's typically not causing the neuropathy, although if the foot gets swollen enough and retains enough fluid, you can get neurological compression syndromes in the foot compartment that can lead to numbness and tingling. But that's, again, it's more of a secondary cause of neuropathy than a primary. Let's see. Depression. Okay, Roxy wants to know, what about depression? So what about depression? Depression can be a form, we can call it a form of neuropathy. It's more of a central neuropathy if we're talking about neurological depression of thought or feelings, sadness and that kind of thing. Very common for B vitamin deficiency to cause that type of neuropathy. So I would, if we're being simple about it, look into those as kind of a hallmark to what might be creating it. How do you check for metal toxicity from ankle and hip replacements? First, that's what Dee Dee wants to know. First, Dee Dee, if you've got a hip replacement and an ankle replacement, and you've got metal in your body, get what's called an MDS. MDS stands for Materials Data Sheet. So this, whatever they put in your body, there is a very extensive MDS on that implant, and you can read what are the metals within that implant, or what are the materials that were used to make that implant. And then from there, what you would want to do is you'd want to get tested for what's called a delayed hypersensitivity reaction, and that's a specialized type of test that can be tested against metals, so you can determine whether or not your immune system has started to view your own implant as an enemy. I've seen this happen in a handful of cases over the past 20 years. I had one woman that was reacting to a screw that was implanted in her foot, and I had another gentleman who was reacting to the mesh. It was a hernia mesh that he had surgically put in for a hernia, and he was dying from it. His body was having such a severe immunological reaction to the mesh that he was close. He was on death's doorstep before we figured it out, and now he's doing great. But yes, you can get hypersensitivity testing to the different materials that your device is made from. And my advice to anybody getting ready to go through surgery would be to test for that stuff before you have the implant put in. If you really truly need the implant and need to have the surgeon put it in, then test for metal toxicities and test for the sensitivities before you do the implant. And that way you could, there are options. You might have one implant made from, certain materials that you're reactive to, and another implant that you're not. And so that might be a better option for you as a unique person to go with. I don't know why surgeons don't do this as a standard of care. To me, it always made sense that if you're going to put a foreign object into a person's body, because we know about it, there are textbooks written on the topic of foreign objects, creating an autoimmune process in the body when the body is overreactive. And so we know this. Why doctors don't test for it as a standard of care, again, that's beyond me. Let's see. Kay Schultz, she's got a neuropathy that includes sensations of insects biting, fire ants crawling, and electrical shocks. Doctor's at a loss. Could this be related to iron deficiency or Hashimoto's? It can be, but again, look, if you really want to rule out a neuropathy and its cause or its origin, you've got to do really some fundamental things. Number one, you've got to rule out physical causes. So physical causes would be, again, what I talked about earlier tonight. Number two, you got to rule out chemical causes, whether that's chemical toxicities or whether that's nutritional deficiencies. Those things are the hallmarks of where you're going to find the majority of your answers when it comes to mysterious neuropathies. I've seen it play out 1,000 times in the last 20 years where people had chronic neuropathy of unknown origin come to me, and we find out it's something simple. So, I say simple, relatively simple. It's not super complicated, although it was super complicated for so many other specialists before them. And it's not that it's that complicated. It's just that most doctors don't value nutrition enough to even look at it. They just don't appreciate it because they don't have an understanding of it. And that's, one of the fundamental problems of medicine today is that 7 hours or less of nutritional classwork gets instructed on in medical school. And so if a doctor really wants to get nutritional specialization, they have to go outside. Once they graduate, they got to go to postgraduate courses for years before they can get the knowledge and even be kind of at a level where they can say, I have some knowledge. I'm not talking about mastery. I'm talking about basic information and basic knowledge. And to give you an example, I went to postgraduate classes on nutrition for 3 years, and that was after having a very heavy nutritional curriculum, which is why I kind of have an advantage over a lot of other doctors. I'm one of, maybe 350 doctors in the world that is board certified as a, DACBN stands for Diplomate with the American Clinical Board of Nutrition. So we are the doctors that have a greater degree of nutritional training as a minimum criteria to be able to practice in this way. And there's just very few of us. There's just not a lot of us that are out there. Let's see, Dwayne, I'm on hydrocortisone tablets and Synthroid. I had a pituitary tumor removed and it left me taking those 2 drugs. Well, yeah, if you're on those medicines, Dwayne, as a result of having, a tumor removed, that's a little bit different, right? You took the tumor out, probably it was going to save your life. So, without knowing more of your backdrop or history, but, ask the doctors that are prescribing that hydrocortisone and Synthroid. First of all, you should know that Synthroid, if you're trying to be grain-free on the no grain, no pain diet, Synthroid's got corn in it. So ask your doctors about compounding Synthroid without the corn. The other thing is with hydrocortisone, you need to understand that that drug itself is going to, over time, it's going to cause bone loss. It's going to cause muscle loss. So you have to be ever more aggressive about how you exercise. You have to be ever more aggressive about monitoring your nutritional status. We didn't even talk about vitamin D tonight. That's one of the side effects of corticosteroid, is they cause vitamin D deficiency. And vitamin D deficiency can also cause neuropathy. We didn't talk about it tonight, but it is one of the nutrient deficiencies that can cause neuropathy as well. Susan says, or question mark, trigeminal neuralgia. So what about it? Trigeminal neuralgia is a form of neuropathy. I've seen a number of cases of trigeminal neuralgia respond really well to a gluten-free diet. And when I say gluten-free, I mean wheat, barley, and rye, but not just wheat, barley, and rye. You've also got to cut out the corn and the rice and the sorghum and the millet and the amaranth, buckwheat, and quinoa, the pseudo grains, the pseudo cereals. If you haven't done that already, then do that first. As a simple dietary intervention to see if it helps improve how you're feeling. Yes, I've heard of, Lisa wants to know if I've heard of St. John's wort causing tingling all over the body. Yeah, St. John's wort, especially if you're on an SSRI, those two should not be given together. So like some people that are taking drugs for depression also take St. John's wort naturally. And those two drugs, those two things don't play very well, and they can create and contribute to neuropathy and different types of problems. So if you're on that St. John's wort and experiencing that, my advice would be stop it. And if all those symptoms go away, then you have kind of a direct answer to it. Does a conventional doctor take the necessary tests for vitamin deficiencies? In my experience, Carmela, no. Conventional doctors, even if you ask them to run the tests, a lot of times they don't know what they're doing. So they look the test up in a book from the lab, and then they'll order tests, but they don't understand the methodologies, or they don't understand the accuracies of the different types of nutritional testing very well. So what they order may not be super accurate. That, again, that's not saying all doctors, but traditionally, in my experience, and I've been in practice about 20 years now, I've not yet seen a person come to my clinic where it was common that their traditional doctor measured the right methodology of testing to really ascertain somebody's nutritional status. Okay. Oxytocin for 12 years. Took myself off 4 years ago. Can my body heal from the damage? I modified keto. Just developed AFib during surgery. Jamie, I mean, that's a bigger question than what I really could probably guide you on in this type of medium, because you really should have a full gamut of a workup done to really try to ascertain, what else might be going on that's contributing to what you're having. So, 2 girls in a pressure cooker. I like that name. I have chemo-induced. Can it get better with long-term B12 and folate? It may get better. Yeah, I mean, even in the short term, I've seen cases of chemo-induced neuropathy where improvements were actually quite quick. So it depends on the person. But yeah, I have seen it get better, and I've also not seen it get better, but it's real inexpensive and very safe to try. Alpha lipoic acid. Gerardo wants to know on alpha lipoic acid to regrow nerves damaged by different neuropathies. Yes, alpha lipoic acid, and we really didn't talk about that tonight, but alpha lipoic acid is a very, very potent antioxidant, and it's very, very potent at helping regenerate damaged nerves. I have a formulation called Alpha Max, and that's used in this type of scenario for people that really, really struggle, and we're trying to really help support their ability to regenerate new nerve tissue. So great. I'm glad you brought that up, because I meant to bring it up tonight. It just got lost in the mix. Thanks, Gerardo. Can using a foam roller take pressure off the nerves, and is it safe to use a foam roller in the same area every day? Yes, it's safe to use a foam roller. Can it take pressure off of the nerves? The foam roller is more going to break up any type of adhesions that you might have that are kind of adhesing and like restricting the movement of the nerves. Probably not physically going to take the pressure off the nerve. It's just going to make the tissue around the nerve more fluidic so that nerve is not being restricted in its movement. Let's see. What about benfotiamine? Well, I did a whole show on B1, Dwayne. If you want to go back and watch that, I talked about benfotiamine as one of the best forms of vitamin B1. Definitely something that can help with neuropathy. Jamie wants to know about mold and mycotoxins. and those I'll answer this question shortly. Those mold and mycotoxin exposure can be one of the things that causes neuropathy. And I've done a few shows on that, Jamie. If you go back in my archives, you'll find part 1 through 4 on mold toxicity and how to remediate and how to get it under control, both mold and mycotoxins. Okay, Michelle, what about methylcobalamin plus 50 micrograms of B12? Any benefits to this combination? The question doesn't make sense, Michelle. Methylcobalamin plus 50 micrograms of B12. Are you talking about cyanocobalamin, adenosocobalamin? Are you talking about hydroxycobalamin? Because there's 4 major forms of cobalamin. And so methylcobalamin is a great form. 1,000 micrograms might not be enough to correct the neuropathy. It's a low therapeutic dose. It doesn't, 5,000 micrograms is generally where I start people. But as far as the other B12, I'm not sure. I didn't get any clarity from you on what you meant by which other form. Can neuropathy in the brain be reversed? Denise wants to know. Was B12 deficient for years? I'm confused because one test shows I'm deficient and another test shows my B12 is over the normal range. It's because you've had a serum test done. Serum tests, again, they're really not worth the paper they're printed on as it relates to B12. They're just not super accurate at helping you understand your B12 status. So without knowing what your other result was, it's hard for me to comment on the validity of the other test. If any of you though that are doing hair testing to try to isolate vitamin deficiencies, don't waste your time. There's a new company that's out there right now doing hair testing, and I just don't recommend hair testing if you're trying to nutritionally assess somebody accurately. Well, I like this one. Leslie wants to know about erythromelalgia. There's only like 13 or 14 cases in the world, Leslie, and at least to my last knowledge. And I actually I'll say the honor and the privilege of treating somebody with this particular condition. And it's an autoimmune condition that affects the valves in the veins. And so what happens is when a person starts to walk, because those valves don't close in their veins, the blood pulls in their feet, so they can only go so far before their feet burn tremendously and they have to stop and prop their feet up. And so this is an autoimmune condition. In the one case that I've seen, and again, I'm by no means am I an expert in erythromelalgia, but in the one case I've seen, we took a woman from walking about 100 feet before she had to stop to walking several blocks where she could keep going. And so, and that was through, and the way we were able to do that was one of the things we found out about her was she actually was gluten sensitive. And so, again, autoimmune disease, most forms of autoimmunity, in my experience anyway, have some progenesis behind gluten, meaning gluten is one of the big reasons as to why many of these people develop autoimmune disease. So that might be helpful for you. Okay, can damage from B6 toxicity? I think I answered that one. Let's go down on that feed a little bit more. What about sciatica pain that goes down the leg to the calf and will not go away when standing up from a sitting position? What deficiency? So Maxine, depends. The sciatica, by default, if you've got sciatic nerve pain, it could very well be because of a structural issue. A lot of people have a muscle in their pelvis called, it's not a lot of people, everybody has this muscle, period. It's called a piriformis muscle, but it can get really tight and spasm, and it can put pressure on that sciatic nerve, whether you're seated or whether you're standing, and it can cause that neurological type of pain. You can also have a herniated disc that's compressing into the sciatic nerve as it exits the spinal cord, and creates that type of radicular pain pattern as well. So best thing, if you've got a sciatica, the first thing that you should do is don't suspect this so much as you suspect a physical problem. And my advice would be get with a good chiropractor. They're really, really in tune with diagnosing sciatica accurately and getting you the right kind of therapies to help you. A lot of people, kind of maliciously attack chiropractic, I think unfairly. Chiropractors are some of the smartest practitioners in the world. They virtually have the same training as medical doctors, minus the hospital rotations. They virtually have the same training and background. So smart folks. Some of the smartest people I know are chiropractors. Let's see here. How does gluten cause autoimmune disease? Asks Jeffrey. No, I don't mean glyphosate either, Jeffrey. So that was, I guess, part 2. So glyphosate is the poison that's being sprayed on our food, right? And it's a industrial chelating agent that used to be an industrial chelating agent, meaning it was used to scour metals and descale things. And then it was discovered that nothing would grow. And so then they turned it into a pesticide, herbicide. And so now they spray it on a lot of our plants and a lot of our food. And it definitely is a poison. It's a known carcinogen. And there's really great suspicion that it contributes and triggers autoimmune disease. But gluten in and of itself also triggers autoimmune disease through a number of different processes. Many people with gluten sensitivity, and not everybody's gluten sensitive, but the ones that are gluten sensitive, when they get exposure to gluten, they have an immunological reaction to that gluten that sets the stage for damage of their own tissue. And so celiac disease is the prime example of that, where gluten exposure can lead to an immune system that goes rogue, that begins attacking the villi in the small intestine, leading to damage of the small intestine, inflammation in the small intestine, and subsequent malnutrition, which can then lead to a host of other problems. So gluten causes autoimmune disease all by itself. Glyphosate, there's no research that says directly that we can say we know for certain, without beyond the shadow of a doubt, that glyphosate causes autoimmune disease, at least not that I've seen published. But there's a lot of clinical anecdote and there's a lot of clinical suspicion that glyphosate is linked to a number of problems that the modern world and the modern food supply are facing today. So great question. Okay, Michelle says, became vegetarian, no dairy, no gluten, no sugar, some fish to combat cancer, have Hashimoto's, have neuropathy in feet and hands. Should I supplement with more B12? It's a good question, Michelle, but what you really should do is have your nutritional levels checked so that you know whether or not that's the right thing. You know, if you became a vegetarian, it's not to say that vegetarians can't get B12 from their diet, especially if you're eating fish, but you're definitely going to put yourself at a greater risk for the development of a vitamin B12 deficiency if you're following a the traditional vegetarian-based diet. Okay, what is the best test for B vitamin deficiencies? Again, I'll say it again, lymphocyte proliferation. So it's where the doctor draws your blood and they draw out the type of blood cell called a lymphocyte. These are your immune cells. The lymphocyte's a great medium. Why do we use it to test for deficiencies over, let's say, other cells? It's because it has a 6-month life cycle, so it can give us an average of your nutritional status over a period of about 6 months. So it gives us this nice long window about what you've been eating and how effective that's been at getting into your cells. It's the other reason why we use intracellular versus serum, because intracellular, remember, your vitamins don't work in the serum, they work inside the cell. That's where all the activity happens. So we want to know whether the vitamin is getting from the serum into the cell. And if you stop short in the serum, you could have all this B12 in your serum, but if it's not penetrating into the cell, you're still out of luck and you're still going to have a deficiency. So intracellular analysis. Nancy wants to know, can you eat organic oats on a gluten-free diet? I'm still waiting for your book. Well, when you get my book, you'll learn that no, you can't eat organic oats. That oats contain a type of gluten called avenin, and there are a number of research studies that show that people with gluten issues react to avenin as well. So if you're really trying to dial it in, you don't eat oats. Can alpha lipoic acid and carnitine supplements cause neuropathy? I've never seen that happen. Gregorio, I don't know if I pronounced your name right, but I've never seen that happen. I don't ever like to say no, something can never cause something else, because I've just been in practice long and there's too much biochemical individuality in one person to another. I've seen some people react to a vitamin or to a mineral, that was very, very unique to their own situation and circumstance. And I'd never seen that clinically before. And we tested it by removing it and re-adding it in. So I would not say that it couldn't cause it. I would just say that I've never seen it clinically cause it in somebody. And I used a lot of lipoic acid and carnitine. Okay, let's see here. I think we're pretty much out of time. So follow up on that sciatica question, then we got to wrap it up. Piriformis muscle not working. Stretching piriformis muscle is not working. Is there anything else that can help with the sciatic? Yeah, get an x-ray, get an MRI, and make sure you don't have a herniated disc that's creating that sciatica symptom. Have your sacroiliac joints adjusted. Sometimes having your SI joint adjusted can be effective. If your chiropractor is already doing that, great. And sometimes one of the other things that has to happen with the piriformis muscle is there's scar tissue or adhesion that's in it that's super deep. So just general stretching won't work. And so what really has to happen is somebody's got to get in there and do what's called myofascial release or manual therapy. There are a couple of techniques. One of them is called Graston technique. Can be very, very effective at loosening up any kind of fibrotic tissue that might be adhesing and creating that sciatica nerve pressure. So those are all other options for you, Barb, that might be very helpful. So, all right, folks, we got to wrap it up. It was great being here with you Monday night. Hey, if this is your first show, if you're new to Pick Dr. Osborne's Brain, just make sure you mark it on your calendar. Every Monday at 6 p.m. Central Standard Time, we're here for you to help you. Our goal and our mission is to help save 100 million lives. So as always, I'd appreciate it if you would hashtag me tonight so that people can find us. And the hashtag is save 100 million lives, no spaces. Remember, we're trying to reach the people that can't get this information, that don't have this information, that have doctors that refuse to talk to them about this information. We're trying to enlighten the world, get people educated. So if you're new, make sure you're subscribing and make sure you come visit me at glutenfreesociety.org, where you can learn more about how the gluten-free diet can help reverse autoimmune disease and chronic pain. And if you come over there, you can sign up for our newsletter and we'll send you for free a free gluten-free survival guide to get you started on the diet. And as always, thank you for your listenership. Thank you for tuning in. It's a joy for me and a privilege for me to be able to spend my Monday evenings with you, helping you. So we'll see you next Monday. Wishing you excellent health. This is Dr. Osborne saying good night. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.